been talking about sort of early startup strategy, thinking about licensing, some of the terms, working with different offices. On the other side of that, we have Larry from MD Anderson and the Strategic Ventures Office. I'm from Strategic Industry Ventures Office, I apologize, from MD Anderson. Thinking about the other side of business development and licensing out on the other side. So he's doing it from the perspective of MD Anderson, but I think there's lots and lots of lessons learned. So.
Okay, perfect. All right, can everybody hear me? All right, I managed to break a bone in my ankle about 5 or 6 weeks ago, so I will probably move around some, but if I stood the whole time, it would start throbbing, which is rarely a good thing. So anyway, this is I guess last year, so I guess it's my second time to do this. And again, I had fun. I don't know if everybody else did, but it's kind of nice to talk about some of these things. And it was strange last year doing it on a Zoom meeting, and so I guess now face to face seems strange. So, but it's all good. So anyway, thanks for the introduction, Sarah. As she said, I work at been at Anderson about 8 years now. Work in the Strategic Industry Ventures Group, which is kind of a fancy way of saying anything that doesn't fit cleanly into another box at Anderson as far as interacting with industry. Our office will probably get involved somehow. So both the Office of Technology Commercialization, kind of the traditional licensing group there, and our group report up to the same senior VP who is in charge of pretty much anything that touches on intellectual property at Anderson. So that's kind of who I am and where I live. Okay, so and again, I apologize for sitting, but the orthopedic issues aside. So just a quick overview, kind of 30,000-foot overview of what I hope to cover today. And by the way, you can probably tell I'm relatively casual. If there's a question on something, please interrupt. I mean, we can wait to the end, we can do it right then, but I'd rather if there's something that's, either I've said or on a slide that is, that sparked a question or a comment or whatever, please feel free to chime in. So I'll, again, just give you just a real quick little overview of kind of who I am, my background. I'm going to define some terms, go into the types of deals and sort of the things that are available in a toolbox for what I'm calling business development. Talk about a lot of examples, and then hopefully the slightly more painful and interesting part of the discussion on best practices, mistakes, scars, blood that's been led over the years, and that sort of thing, and some lessons learned. So again, some of this, my assumption is on a couple things. I don't know, I tend to look at the world through a therapeutic lens, so some of these would be applicable across all genres, others would be probably more specific to therapeutics, small molecules, that kind of thing, so, or medical devices. So I apologize if your focus of your company or project or program is not, that squarely syncing up, I guess, with what some of the discussion is going to be. Okay, so just a real brief background, kind of who the heck is Larry Hope. Kind of a weird mix. Most folks in our office on the technology licensing side of things have a PhD in just, typical sort of biological sciences type things. I'm a little bit of a weird hybrid, so, master of none type of person. Undergrad in microbiology, MBA in finance and entrepreneurship. I worked at a little biotech company up in the Woodlands back in the early 90s, and the company went public at the time, which kind of opened my eyes, I guess, to the business side of biotechnology, and been sort of in or near it for going on 3 decades now. I guess most of my professional career has been focused on commercialization, startups, tech transfer, licensing in the academic environment, but sometimes it's bringing outside, I should gesture with the hand with my microphone in it, sometimes it's bringing IP from the outside into the university for, betterment of a project, sometimes it's out licensing our own programs, that sort of thing. And again, talk about, the BD efforts and all that, but again, my world tends to be more therapeutically focused. But, in general, there's other things too, I think that I'd like to think makes me an interesting person. I love to tinker and play with things in the garage, and I think that I do basically the same thing professionally. You take bits and pieces of things and you build or create or modify things. So I think it's just kind of part of who I am. And just by the way, I always be leery of a person who any car they've worked on and drive around with a fire extinguisher. You should probably always be somewhat cautious. Okay, so as I mentioned a while ago, the sponsor, or I also realized that Strategic Industry Ventures, SIV, is also, I think, simian immunodeficiency virus or something like that. That's been pointed out more than once. But as I mentioned a while ago, we're basically responsible for connecting the dots between industry, all these different types of things that you'd imagine would come up in the research organization at Anderson with the commercial world, ultimately for the benefit of cancer patients. We are economics that we drive through these deals and transactions are not the goal, but they're part of the equation. I mean, ultimately, our motivations are to bring therapies, devices, things that are created at Anderson for the betterment of the world and give patients additional therapeutic options typically. We can't ignore economics, but most of the economics that come back to Anderson through our activities are ultimately plowed back into research at the institution and that sort of thing. All right, so you hear in business development, I think kind of means different things to different people. In a lot of you go to LinkedIn and search around on people's titles or open jobs and that kind of thing, and it seems like it either falls into sales organizations and it's literally it's a sales job, or it's more of a, let's kind of call it a working on the business, but kind of building it or creating value, I guess, in kind of non-traditional ways. And so when you hear me say business development, or at least I think in most places in the kind of biomedical world, it tends to be more of that. I look at it as a strategic kind of value additive type activity mentioned here. Typically involving intellectual property and economics, but again, kind of make it, define it as you see, but again, it's either going to be sales and marketing, or these types of things. All right, and so, we use almost interchangeably, what is a strategic partnership? A collaboration, alliance is something that's frequently kind of, talked around in our group. And it's an overused cliche, but I mean, typically it's something where the sum of the parts is greater than the individual pieces. I was kind of joke that it's ultimately a lot of the things that we work on is where 1 + 1 = something ideally greater than 2. And again, kind of similar to the previous slide, long term, we're ideally looking for long-term synergistic relationships that benefit both parties. I mean, that's a lot of analogies to dating and marriages and that sort of thing, but that's the type of thing that we are typically looking to put together. And you'll see later in the discussion, it's not always this sort of happy arm-in-arm, pleasant relationship, and those are some of the warning signs and stuff that we typically will look out for. So just a couple of comments on this slide. I mean, this slide's actually probably a little old, but we deal a fair amount with large pharma companies and large therapeutic companies, both on like clinical alliances, where they want to come in as an example and run multiple studies on KRAS driven tumors, or multiple studies on multiple leukemia products, all in parallel in the clinic at once. I fortunately don't kind of play with those sort of things. I've got a partner in crime, Emily Barnhill, who tends to do more clinical alliances and that sort of thing. And then also included on this little logo cloud, I mean, there are some small companies, a few of them that we actually started. So it runs the gamut of partners, I guess, from huge public companies, large private companies, small public, small private, kind of runs the mix. And occasionally there's interactions with other academic institutions as well. Again, a little caveat here is that, again, considering my background, I was 12 years at Baylor, 8+ now years at Anderson. It tends to be an academic perspective on things, but at the same time, I think there's a lot of lessons that can be applied here. So, I guess the big question is why even do this? I mean, you've got I assume, a company, a dream, a vision, a platform, IP, something like that. Why does it make sense to engage in these types of external relationships? And this is just a kind of top of mind type list. and again, this applies both to Anderson and our own projects, and then with our outside partners coming in. But I mean, it gives the parties involved access to additional intellectual property, both things that you need, or that you absolutely need, or that you would like to have. Again, I'm thinking more from outside companies coming to Anderson. There's expertise, whether it's cell therapy or access to the clinic or manufacturing or regulatory expertise, that kind of thing, that frequently are available, outside the walls of a potential partner. Again, a lot of these are somewhat obvious for the academic environment, facilities and equipment that may not be available. You got to be kind of careful at times. Sometimes there are companies that will approach places like Anderson wanting access to, tumor banks and that kind of thing. And and especially data, the concern that we have, and I don't think it's unique to Anderson, is one thing, if we never want the appearance of, that we are quote unquote, selling patient information, or especially like selling patient tissue. If patient tissue that's been appropriately consented is part of a larger research collaboration or something like that, that's fine. It's just we can't and we wouldn't say, hey Larry, I want to buy 200 samples of melanoma biopsies. How much would that cost? That's just not. It's not a quid pro quo kind of thing like that. Same thing with data. There's a lot of sensitivities around outcome data and that sort of things. We do have some large relationships that rely heavily on those sorts of things, but again, there's kind of a bigger, overall sort of package. Same thing, and again, these are biased from an academic standpoint, but there's at times, and I don't mean anything I say to be taken as arrogant. Hopefully, it's not, but a lot of times folks will come to places like Anderson, and the same thing with a small company approaching a large company. You're getting validated. If you've got the chairman of leukemia that's excited in your technology or platform, that's going to help legitimize you, probably make fundraising efforts easier, those sorts of things. So, there's a certain amount of that. And the same thing, you go talk to Merck, and they're a customer or a collaborator on something. It's obviously not gonna hurt. And a lot of the stuff I'm gonna say today is, I think will be painfully obvious, but others, maybe there's some nuances or some things that haven't, maybe not be fully appreciated. But anyway, all of these things, and again, this is just kind of a representative list. I mean, ultimately, it's all to create value and or reduce risk, which is also, I guess, another way of creating value. Sometimes, though, these things are done to kind of clean up, not a mess per se, but clean up some issues. And a good example of this would be, so years ago we did a very large transaction around a cell therapy platform. The scientists that developed that, and they did nothing wrong, but they incorporated some bits and pieces of some IP into this platform that were owned by other people, some of them academics, some of them others. And it would have been nice to initially just not have incorporated those pieces of intellectual property of other people, but they did, and there we were. And there was a fair amount of, a little bit after the fact, negotiating and sort of arm twisting to a certain extent of getting proper kind of title and clearance to all of the components, let alone our larger platform, so that could be packaged up and then licensed out to industry. Because our fear on that kind of thing, if we don't have a whole package that can be turned over through a license or a collaboration or a startup or something like that, sometimes it'll kill the deal, which is the worst case scenario. Other times it's like, well, gee, we have to go get these other licenses, and we're not really sure if we're going to be able to secure those and what terms, and we may be taken advantage of, so we're going to give you significantly less value, or it's going to be extremely back-end loaded. And so we've been burned on enough of those sorts of things in the past where we really try to proactively go out and get the rights that we think we're going to need, but that's sometimes it's more kind of a cleanup type exercise. There's been times where we've gone through that and we could not clean it up and we had to go recreate the wheel. I'm thinking of another different cell therapy where there was a construct that was critical to it. We couldn't get clean title to it. It was a long, laborious search through, I think, 4 different groups and going back to papers from 1991, and we we couldn't get clear title essentially to an unpatented construct, but since we had the materials, it was just this big ugly mess, and we just had to make them again. Not a huge thing, but it was just one of those more of a pain than, and obviously best left to be avoided. Just some of the tools of the trade, and I realize on one hand, I mean, I love my job. It's a lot of fun. There's a lot of cool things. But
This is Josh Cannon. So may I, because this is a very important point what you raised.
Okay.
So we are scientists. Okay. We collaborate, and we have colleagues. And the others from there. Okay? You understand that I know about what you talk. So how can we avoid this type of mixture of intellectual properties between two collaborating groups and two collaborating institutions when the science is built in this way?
Yeah.
So with whom should we talk, or what is the strategy that you recommend in order not to get in troubles with
Sure.
the companies and such?
Well, and it's something, George, I mean, sometimes it can't be avoided, so that's part of it. And other times, we never ever want the business pressures to lead or have undue pressure on the scientific discovery side of things. There have been some instances where after some initial proof of concept experiments took place, said, great, now let's, instead of relying on this antibody that's only available and it's not available on the market, it's only available from Merck, why don't you now go make your own antibody or find one that is commercially available now that you've proven that it would work in that system, versus forging ahead with, just in this convenient example, Merck's material that's key to your thing. But as far as collaborating with it's not uncommon for our office to get called in. It's happening with a little bit more increasing frequency of like, hey Larry, Emily, Jean, I've been working with this thing, it's really, really cool. I mean, we're doing a lot of this now with CRISPR technology, trying to get something from several of the companies that are out there that'll make a sort of broad flow-through license from the company to Anderson, so any Anderson researcher can use, what is it, Caspase 9 or 12 or whatever, the flavor of the day is, where we already know that it's not going to cause a problem going forward. But part of it is just being aware that it could be a problem, and it's not at all uncommon for us to have to talk to the tech transfer office at Baylor or some other place to look, we've got this program, there's this piece that's over here, this is jointly owned, we'll need to put some sort of, it's basically a prenuptial agreement in place, an interinstitutional agreement that says, how can we get access to these rights? We're not cutting you out of the deal, but we also want the rights to go forward with something else. So I think just being aware of it helps.
So the point is to come very early to people like you.
I would rather,
to discuss early.
I would rather a little too early than a little too late. Yeah, which is, yeah. All right, thanks. So, and like I said, I enjoy my job. I think it's actually more kind of fun and thrilling is a strong word, but exciting on a lot of aspects. But then when I was putting this list together, I think that's pretty boring. It's just everything is an agreement, and it's all kind of a paperwork based thing. Which is there's a certain amount of truth to that. I mean, I live in an area, and these types of things take in place in an area kind of between the scientist, the institution, and a pack of attorneys. Sometimes internal ones, sometimes folks like Andrew Strong who are here. And it just kind of depends. But ultimately, in a lot of the deals that we work on and that you and your companies may work on, there may be bits and pieces of components from these. It may be 3 or 4 documents that all sort of work together to ultimately get to kind of whatever that goal is. I'm going to focus just a little bit more on some of these kind of later on the list. I mean, things like a confidentiality agreement or material transfer agreement, those things are done all the time. I mean, there's really kind of nothing necessarily special about those. It's when things start getting a little bit more complicated or jumping across multiple stages of development. It's a lot of times where they start getting more interesting and potentially, I guess, with a few more downfalls kind of baked into them. But anyway, these are kind of the tools of my trade, and things that you would bump into, again, assuming as you guys go forward and hopefully put it in the universe. Someone here, and this will come up a little bit more kind of later in the talk. I would put relationships on here 3 or 4 more times, because things have an inherent biological and clinical risk, but if you don't like the people you're dealing with or you don't trust them, it just makes things 10 times harder. And there's most of the interesting stories we have to do more with that than, gee, the patent didn't issue. You know, it was something along those lines. Another, you know, kind of tortured analogy here is instead of a toolbox, but, you know, we have these not interchangeable, but a variety of different pieces that can be put together to build a variety of different relationships and kind of, you know, ultimate outcomes. So, you know, that's, I guess, one thing kind of take home from this is none of this is standard. I mean, everything is kind of fine-tuned and customized kind of as you need or what the goal is. So just a quick, you know, kind of, you want to call it kind of a roadmap of the deal. And again, this is idealized. No transaction I've ever worked on followed all of these. I mean, sometimes you just happen to start off down at 9 because you got pulled into a deal late, or, you know, some of these were kind of jumped or they were out of order. And again, I'm speaking from a kind of an idealized, typical project that comes into Anderson. Shouldn't be too different for most other academics and a lot of other companies. But, you know, at some point there's initial contact. Frequently, that is, not always, sometimes that's our office contacting folks or companies that we know we have a platform or a piece of IP, they have an expertise or an interest in that. Sometimes it starts from there. It's almost always, though, scientists are clinician driven. They're at a you know, the AACR or an ASH meeting, and a company comes up or an investor comes up and they'd like to talk about this, or they saw a poster, or they saw a paper. So a lot of times there's initial, it's almost always scientifically driven, but there are certainly some exceptions to there. We'll have a lot of times kind of a high level type discussion, sometimes just the BD people to it kind of depends. If it's Merck coming to us and want to talk about something, it's Merck. If it's, you know, two folks in their garage and they have raised $100,000, that's going to be a different conversation about, you know, I mean, I hate to say, is this company and are these people and the investors real? Is it something that really, you know, has the potential to kind of make sense? So there's some vetting and stuff that goes on. Typically, you know, non-disclosure agreement will be put in place. Lots of calls, due diligence, sharing of information, but going both ways. I mean, a lot of times we'll ask people specifically about if it's not publicly available or there aren't press releases, you know, their financing history, how much money do you have in the bank, that kind of thing. It's not all about that, but we also have to know that we're potentially, you know, kind of dating potentially a partner that has the ability to kind of take whatever we're talking about and, you know, go forward with it. Assuming that all of that makes sense, there's typically at some point a term sheet that probably has either a work scope and or sort of the licensing economic or relationship economic type components nailed out or you know, lined out. Fair amount of you know, discussions and negotiations around a term sheet like that. And one reason it's nice to start, our term sheet's typically 3, 4, 5 pages, but it's not, when attorneys start getting involved in these, it starts looking more and more like a legal document. It's like, no, we need to stay at 30,000 feet and just focus kind of on principles and philosophies on things, and not so much like the details of the definition of, you know, licensed product or something like that. And ideally, hopefully, once we get to the point where everybody's comfortable with the again, the economics and kind of the parameters of the relationship, that's when we'll typically bring the attorneys in. And again, we try to address the bigger items in term sheets. Inevitably, there's going to be some things that weren't addressed that will come up in drafting, which will cause somebody dyspepsia somewhere along the way. There's always a few issues. They're almost always different for people. Sometimes, you know, there are some common areas. And ideally, hopefully, kind of getting down here toward the bottom, we execute the documents. There might be 1, there might be 10. It just kind of depends on what it is. And, you know, as I kind of joke, that's typically the end of activities for our office, but then that's where the work for everybody else really begins. And we will sometimes be involved. Sometimes you'll see like an alliance manager on the other side that's involved kind of in the operational side of things. We don't do that as much, but we still keep in contact with the folks at Anderson, whether they're clinicians or kind of the South Campus therapeutic discovery folks. Did Phil Jones come out, Sarah? Was he here talking to this group?
He will be out on Friday.
Okay. So you'll meet Phil Jones, he is as tall as I am short. He's a very, very wicked smart guy, and he's the VP of therapeutics for Anderson. And you know, they're kind of he runs basically a captive biotech drug development company on campus, and he'll talk about, you know, a lot of these kind of things. So there's always a handoff between our group And the technical folks have been involved all along, but you know, at that point, once the deal is done, we very much take a back seat in those interactions, and again, that kind of goes off to everybody else's the scientist work. So I've got some examples here of just some things. These are mainly shared to kind of stimulate thoughts among us. Again, all of these are fine-tuned and different. Some of these are, you know, kind of a little idealized, and there's some examples, but then there's also some almost kind of like non-detailed ones, I guess, as well. As I mentioned a while ago, my partner in crime, Emily Barnhill, she's the one that tends to work on large clinical alliances. I gave some examples of those a while ago. There's lots of error bars on these, but for Anderson, it's not uncommon for those to be, you know, kind of a $15 million multiple year, you know, multiple year commitment. Sometimes it's specific to one type of cancer, one therapeutic area. Sometimes it cuts across, you know, multiple departments. A lot of times there's a theme. I mentioned, you know, like KRAS-driven tumors and that kind of thing. There are not, normally for these types of things, the company is coming to us with a program they want to put into the clinic in a big way. While Anderson has expertise in a lot of things that have been built over 7 decades, I think however long Anderson's been around, there's rarely downstream economics associated with these, something like from a license or whatever, which kind of makes sense. I mean, we're adding value and expertise, but we're getting paid to do that. But there's not additional like inventive creative stuff, you know. So Merck comes up and they've got a, you know, compound X, and it's got these, you know, R groups hanging off of it. They've already done the inventing. They've been working on that compound probably for 10 or 12 years, and so these kind of things rarely have these sort of downstream economics, although there are some exceptions. Another kind of example of some things I've kind of, you know, talked about. Not uncommon for us to do joint ventures or startups. The phone call I had 9 o'clock earlier was the embryonic thoughts on a PCR engineered T-cell startup that we're contemplating. Again, nothing unique to Anderson. I mean, a lot of academics will do these sorts of things. So not common, but you know, they're certainly in the mix of things of kind of outputs and outcomes from our type of activities. And again, same thing. You know, you interacting with partner, bigger or smaller, you know, partners. These kind of things may come up. Sometimes it makes sense to actually create a new entity that's going to take on this sort of this, you know, goal or dream versus it being, you know, captive, I guess, to one of the existing partners. Again, none of this is I think, you know, too shocking. I mean, these kind of things, obviously, you got to agree on who is going to be contributing and doing what, both financially as well as like, you know, sets of hands and FTEs and that sort of thing. And you know, ultimately, it gets down to kind of ownership and economics of these sorts of things, of all the parties involved, you know, who's going to ultimately own or benefit and in what way. These are the types of things that I love to kind of work on, where it's a marriage of, and I've got a couple of like more detailed examples of this coming up, but where there's a marriage of outside IP and expertise to Anderson IP and expertise. And these tend to be, I kind of look at them as almost kind of multi-phasic. There's the one I'm thinking of, the example we'll go through in a little bit with a company called Affimed. There was a 2.5 year, maybe 2 year period of preclinical work combining their technology with our technology, a bunch of IND enabling studies with plans to, if assuming it was successful, to immediately go into the clinic. And you know, what does that relationship and all of those economics and everything look like? So you know, it's one of those things, once you do the first one of these you do is always painful, and then after that, now you've got a model to kind of follow and everybody kind of understands what it is. But these are not, I wouldn't say they're common kind of in academia, but I don't think it's, you know, necessarily this rarest thing either. I just realized you can't really read that. Another, I guess, kind of example of the types of things we'll work on are, you know, in-license deals with an option as an example. And again, I've got some examples specifically on this, but where, you know, Anderson takes a license to outside company IP and moves that forward, and then the company that we got the original piece of IP or something critical has a right of first review on that. If they want it, they can license it back for some probably predetermined economics. And if not, then we go forward with it, license it to the Mercs of the world kind of thing, and then they get a passive kind of a piece of the pie there. A lot of times this can make sense for the outside company. Maybe this is an area they weren't planning on pursuing, so it's kind of a free shot on goal. It's a free potential revenue stream for them. It's another group. It's another effort that kind of vouches their base technology, but doesn't distract them away from probably what they're ultimately trying to do. Okay, so a couple of these. This is not a deal that I worked on, but this is one that Emily put in place. Clinical alliance with a company called Aztecs, and again, it was focused on, I believe, leukemia. They provided the funding, the compounds, and all of their support, and Anderson's both running the trials and giving them input and advice through a joint steering committee. Relatively simple, no economics. It's not the most complicated transaction, but a little bit more. It's more efficient for a company to come to a place like Anderson and do these kind of things at a higher level than to come in and onesie-twosie. We want to run 6 clinical trials, and it's 6 contracts and 6 negotiations and all this, so it's kind of a master agreement, although that's a bit of a 4-letter word around our place, but it's a controlling relationship that allows these things to happen more efficiently. This is the example I mentioned a few minutes ago with this company, Affimed. So Affimed makes bispecific engagers that target both NK cells and a target on a tumor. And they had the initial program here was what they called AFM13, which I think both targeted NK cells as well as, I believe it was a CD30 lymphoma, I can't remember. And this was the one where there was a 2-year preclinical, pre-IND enabling stage with Anderson then immediately writing all the paperwork for the IND, CMC, doing the manufacturing and everything, and ultimately going into the clinic. And I think 19 patients have been treated with this so far. And the company, in this original agreement, we had an option. So if the early work was successful, they knew what the license was going to be. So they knew what the terms were going to be, but they didn't exercise that option yet. And it's a way for us to kind of, make sure that we don't get 2 years into a relationship and all of a sudden realize, wow, gee, you guys want $1 billion and we thought we'd get it for 10,000. So it's a way to kind of make sure that everybody's comfortable going in of what the relationship and the economic side of it would be. The thing that's kind of interesting about this is, based on the prior successes with this AFM13 drug, we're now, the license that was executed is expanded across multiple engagers, so it's not just the one, and then there's a second sponsored research agreement type thing that's being put in place. So a lot of times these things will start small and then kind of grow from there. All right, just another, and again, I'm probably not going to go through all of these. Another kind of co-development thing. This is a program coming out of Phil Jones, the small molecule development group at Anderson. We had co-developed an ATR inhibitor with a company called Shang Pharma, and then each company put several million dollars into this program to bring it forward, and then we licensed this. The 2 groups licensed it to this company Artios a couple of years ago, and this is, I believe, in the clinic now as well. And we do a fair number of these, probably 3, 4, 5 a year, of a 50-50 spend sort of co-development type thing. It's taken advantage in this case of Shang Pharma's kind of network of CROs and their development expertise, Anderson's obvious oncology expertise and drug development side of things. So, and this is, like I said, now it's licensed to a company, Artios. We take a much more passive role in this now because the company they're in the clinic, they're raising money. They're a publicly traded company, pretty sure. And so this is, to me, just kind of a good, solid base hit type agreement. Not the economics on this weren't earth-shattering initially, but there are, significant downstream milestones and royalties and that kind of thing ultimately to come in. Again, just a variation on the theme.
What was the role of the RTO in this thing?
What is the what?
RTOs, pharma. What was the role in that deal?
So we developed the ATR inhibitor with Shang Pharma, and then once it got to the point, it had been advanced preclinically and was probably 8 to 12 months away from the clinic. Shang Pharma and Anderson licensed that program to Artios. So they're our ultimate licensee. They're the one that's actually taking it forward. Our development partner was Shang Pharma. Another, just again, kind of variation on a theme. Here with this company Obsidian, they have a cool technology they call CytoDrive, which I describe it sophomorically, I guess, is an interesting, basically they have a rheostat where they can kind of turn on or turn off or even sort of regulate any protein that they want expressed in an engineered cell. And so the idea here was marrying their CytoDrive technology with Anderson's tumor infiltrating lymphocyte, our TIL technology, to make what I think they started calling the CytoTIL programs, the membrane-bound IL-15 or something like that. It's interesting that this involved Obsidian, Anderson's cell therapy manufacturing group doing a lot of the process development work and a lot of the regulatory things. So lots of moving pieces here, but we get another use of our TIL technology. Obsidian doesn't have to go build out a manufacturing suite and do all these other kind of things. Now, granted, they could go, talk to the Lonzas of the world and that sort of thing, but it was having it all underneath one umbrella at Anderson was appealing to them. And then there are economics associated with the development of that main product, and then they're also taking a license to the Anderson TIL platform for use with other CytoDrive applications. So we could take that same TIL platform and go to another company. So it's not completely, but they have a license for a narrow field, and we could go write additional licenses in other fields as long as they're not kind of stepping on the one that Obsidian has. Let's see how many more of these I forgot that I had in here. Okay, just real quickly, kind of a variation on a theme. This is a company, I kind of give one of these in the generic examples. This company, Xencor, has a CD, they have a collection, they're an antibody development company. They have a collection of the bottom part of the antibody, the kind of the stalk of the Y, is the FC region. They have a collection of FC mutations and changes that allow you to do different things with antibodies. And so we had a need to access their CD3 bispecific technology and marry that to one of our programs. And so we put sort of an overarching agreement in place that allows us to show them a program. If it's not competing with them, they'll make the CD3, they'll marry and mesh their CD3 technology into the Anderson antibody technology. And then that comes back to Anderson for additional development. And then at some point in the future, we can go to them and say, look, we've got animal efficacy data or wherever we are. Do you want to take a license to this? And if they say yes, then we work out a deal. And if they say no, then they're kind of a passive participant in that. We go forward with that, license that to Merck or whoever, and then Xencor would just receive a portion of those economics that flowed into Anderson. Fortunately, I mean, this relationship is early, but we already have the first program that we kind of went through this with them. They're interested in taking a license too. So, it's kind of again one of those things that just kind of keeps them building, I guess, on itself. Another just quick example. So this is instead of a CAR T cell therapy, this is a cord blood derived natural killer cell CAR program developed by Katie Rezvani that was licensed to Takeda. And just some of the interesting things here. One thing, it's a different cell type than a lot of the folks working on CAR Ts, which is one thing that's kind of interesting. It was only limited to 4 targets. It's actually since been expanded to 5. Just a couple of take homes with this. This program went from, and I realize you can't always do this, but this program went from interesting, but people really weren't interested in taking a license when it was still preclinical, to once they got into the clinic and they started seeing patient responses. I think 3 out of the first 4 patients had, you look at the CTs and they were like night and day compared to each other, 30 days apart. And it went from, oh, that's kind of interesting, to, it probably won't work, to, wow, that's the coolest thing ever. And then this quickly, quickly over the period of probably a year. Went from almost a feeding frenzy of both large, small pharma companies as well as a lot of VCs pushing us to, ultimately do a transaction around this. Obviously, you can let things ripen and move into the clinic. All that takes is, a bunch of time and money. It's not like you always have the ability or the privilege to do that. But here's a good example where the risk, because it was a new cell type and that sort of thing, was too high. But once it was de-risked, the value went up, dramatically. This the last point on here was kind of interesting. I think this was crazy. We talked to 52 or 53 different companies. 14 or so went into the data room. We ended up getting term sheets from 5 of them, and 1 dropped out, and ultimately, after the dust settled, went with Takeda. Several variety of VC groups were pushing us. You should do a startup around this. You should, why are you not interested in doing this? But the pre-money value we were, going to be allocated from them, it didn't make sense. I mean, the economics that flowed to Anderson from this, there's no world where if we owned a smaller portion of a startup that had this technology in it, would those same economics flow back to Anderson? And their point was, well, you guys are destroying value. I'm like, well, if we don't participate in any of the value, what difference does it make? And anyway, it was kind of an interesting conversation with them. And I realized they have their math that it has to work.
Larry, can you expand on that story? Were the VCs pushing you to form a startup before or after the clinical data came out?
Pretty much after. I mean, we had a couple of early conversations actually with a group that later came back and gave us what they were considering a disproportionate pre-money value on it. It was still quite low. But the same thing. I mean, there were once the clinical data came out and you started seeing signal even in a phase 1. I mean, like dramatic signal. Like it actually kind of gives you shivers when you hear the stories and you see some of these the CTs of some of these patients. That's when, of course, that's when everybody came out of the woodwork. But like I said a while ago, I mean, I don't knock them. Everything they invest in has to have that 10x plus sort of potential, because most of them aren't going to work out. I get that, but it's like, look at it from our side too, that it just doesn't make sense. At that point we don't need outside investor money. We're already at a point where we have value that's been created. I'm going to skip this one. It's just kind of another variation on a theme. Just a quick one here, a little bit somewhat similar to the Xencor CD3 technology for coming into Anderson. This company Bellicum they still might be local, but had a inducible caspase-9 safety switch. Some people call it a suicide switch, where if you introduce cells that has this switch in it, introduce cells into a patient, for some reason they're causing problems with the patient, you can give that patient another harmless drug and it'll kill all the cells that you introduce. So it's kind of I look at it as a kind of an airbag. It's something that you hope you never need, but it's nice to have, when it's there. And we ended up taking a license from Bellicum into Anderson for that Takeda transaction that allowed that whole Takeda transaction to go forward. We've since expanded this to have any cell therapy developer at Anderson has access to this now. Again, there's kind of a vetting process. And when hopefully we're at a point where we're licensing this program to, again, Novartis, Merck, or whoever, startup, whatever, we then would pull those Bellicum rights through Anderson. So our ultimate commercial partner or licensee has everything that they need through us. So it's kind of a one-stop shop. They're not having to go out and get individual licenses to other things. Okay, probably enough of those. All right, just kind of as again a reminder, I mean, every one of those deals that we talked about kind of went through some version of this, some closely, some of them, just were, dramatically different. But again, all of this is, I guess kind of a unifying theme here, and a lot of the things coming up are, I guess, to emphasize the people and the relationship side of a lot of these, these types of activities. And okay, so, safe harbor, let's call it a violent disclaimer statement. These are my own opinions. It's not those of what I'm about to share. It's not those of MD Anderson. shared for educational entertainment purposes. It's you kind of take them for what it's worth, but some of these are literally scars on my hands from mistakes that I've made over the years. Not an official position of anyone, and of course, never run with scissors, and remember to eat your vegetables, all those sorts of things. So again, this part, just some examples of either kind of lessons learned, best practices, however you want to kind of frame these things. And this is where I wish I had sat in on Andrew's whole talk, because there's a fair amount of attorney bashing that's coming up, and it's not bashing's a strong word. Discussions and kind of lessons learned. Andrew is, I think, as we were talking earlier, one of the good ones. Attorneys, and if there are any attorneys in here, I will pre-apologize. It's nothing is personal, but I mean, everybody has their role and their place in the ecosystem, and sometimes you just have to kind of keep that in mind. But anyway, I wish I would have listened to more of his stuff so I could kind of build on it. But Andrew is one of probably 3 attorneys I've worked with that kind of gets it and doesn't. If you're Novartis, you're going to get probably a different level of engagement than if you're a small company, but a small company can't afford a Novartis type legal bill, so he is. I've always appreciated his kind of practicality about things. Okay, so just in general, this isn't the attorney bash. I'll come up in a second. Frequently, so both you've got. You're talking about the relationship and the goal and the dream, and then that's going to get somehow translated into a term sheet and sort of these outline of things. And whether it's at that stage or it is particularly in the drafting stage of things, before you get into a red line, that's what this is supposed to be symbolic of, kind of a red line war of throwing drafts and language back and forth. Sometimes we have to take a step back. Absolutely making sure that you've got philosophical alignment on what you want to do. And that's where I think it helps that it's business people, and again, non-attorneys, but kind of talking through, what do we want to do? Marriage analogy, where do you want to live? How many kids do you want to have? I mean, all those kind of things that you would just talk about kind of at a high level to even make sure that there's, compatibility here. And sometimes that's really what we look at at a term sheet is an alignment tool. Again, some of this seems sort of obvious, but you'd be amazed at the number of times when, you said 80-20 split, and I thought I was the 80, and no, it was the 80 was you. That happened just like me. So there's a lot of things, again, just so seeing things written black and white on a piece of paper, but looking for, again, philosophical alignment versus really kind of getting into arguing literally terms and language back and forth. And even what frequently happens still is we go through that, we're with the attorneys, we're going back and forth, and there are times like, okay, we're at like a loggerhead here, and we'll get back on the phone with the business people and like, look, I think we're all saying the same thing, but your attorneys are looking at it this way, our attorneys are looking at it this way. We need to get aligned to inform them what we want to have happen versus have the attorneys, weigh in too much. And again, I'm cautious here, not wanting to bash them too much, but everybody's doing the job that they think they should do. So we'll leave it at that. Again, something that Anderson, I think, is fortunate. We have an excellent group of in-house attorneys, and everybody kind of has a swim lane, and so I'm not going to veer off into in an agreement. I'm not going to veer off into policy that is, state of Texas Constitution, UT system policy, Anderson policy, things that are a matter of law. We'll defer to them. They defer to us on pretty much anything that has dollars and cents, with a few exceptions. And so they defer to us on business things. We defer to them on legal type things. Not all of the folks, and that to me, it seems kind of to be a healthy, division of labor. Sometimes we're dealing with outside companies that the attorneys have. I would consider a disproportionate amount of influence and power. Maybe that's just the way they are. Maybe that's just their company culture. Maybe that's the way it is. But we always try to ensure that the business folks are the ones dealing with business concepts. And it's one thing for Andrew's a perfect example. He has seen tons and tons more transactions than probably everybody in this room, including me. So he certainly will have an opinion and has seen like what's best practices and all that, and this is just, again, speaking for me personally, I would rather be the one sort of arguing those points, having versus, and again, it's not bad either, versus having the attorneys argue the business side of things. That's just, again, I'm probably biased from some interactions in the past, but just something to kind of keep in mind, because the take home here is ultimately, so after the negotiation's done, hopefully the contract's signed, yada yada, you're gonna be the one that has to live with it. And so if either the business terms are not what you like, or the relationship with the party that you just signed a deal with is so battered and bruised because of your attorneys who are no longer involved in this, it's a bad way to start a relationship. So that's one reason too, is that the folks involved there are gonna be the ones that are gonna have to live with this hopefully for, many, many years. So, okay.
I have a question.
Sure.
So also to Sarah, so for small startups like us who don't have any investment yet, and especially for this period of the cohort, this accelerator program, if we want to seek help, we don't have money to pay attorneys, but we are negotiating with the institution, and obviously they are working in their interest, and also they want to help us. That's fair. But if you want to seek advice, not legal advice, but the points that, okay, this could benefit you. These are the points for you for negotiation that you can. Is there any component in this accelerator program, a defined component where we can approach you or anyone for that kind of help?
So are we asking me or are we asking Larry?
Both of you actually.
So, I mean, Larry, I don't know how you view this when you have your sort of investigators sort of come to you. What I would say from the other side of the table, I guess, so to speak, although I've never had the pleasure of negotiating with Larry before, someday maybe, well, is a couple things. You can probably, as Larry was just saying, it's largely a relationship issue. So you can get through some general consensus, or at least feel things out with your office without getting lawyers involved. You should never do definitive documents without getting lawyers involved, but hopefully at that point you have some sort of path forward, right, where you feel like you have funds, or you can get funds. Maybe you're floating a few $1,000s here. Maybe your lawyer's part of your team almost, and they're kind of floating you up front. Again, that's relationship dependent. Nobody's gonna do that for free without some sort of pre-established relationship. As far as within the program, we are here. I'm being recorded. I have to be careful. So we're always here for advice, right? So I'm never gonna. I can't really get involved in the discussions with any of the institutions per se, but I'll tell you on the things that I've seen. Right, the other advisors that we have access to can also give their perspective on the things that they've seen work, or sometimes it's a matter of coming up with a creative solution. If you're fighting over one term, you sidestep that a little bit and you figure out where you can move some economics. Larry, I don't know how you feel about that.
Yeah, I don't disagree with anything Sarah said. I might speak for the royal we, I'll speak for me. I am not at all opposed to just chatting with people with the caveat, this is not legal advice, yada yada, but gee, this seems like a reasonable approach, this seems a little, part of that is just kind of getting back to the ecosystem. Part of it, a lot of it is officially wearing my MD Anderson hat, talking to MD Anderson people or around, MD Anderson projects, but everybody, fortunately, it's a big ecosystem. There's a lot of really cool, interesting things happening. So, it's nothing to plan a relatively quick call to talk through some issues or something like that. I'm happy, and I'll send that to everybody in the room with the caveat that this is one person's opinion. It's not legal advice. It's not tax advice. Yada yada yada. But Sarah's point. Every school's different. Anderson's probably a little more sensitive about it. We have done, and I appreciate, especially in the early embryonic side, you don't have money. You don't have really anything yet but a dream. We have at times, and I know other schools have put in place almost a letter of intent sort of thing, is like that we're willing to write a license to your startup for these outlined terms if you're able to go out and raise $5 million or whatever. If you were to hit some milestone from that, we're not going to license this to anybody else while you're kind of in this sort of interim period. So it's kind of a poor man's option, but it's a way to at least to say you can go show that. Now, they may not fully appreciate it. You go show that to an investor and say, look, I've been in contact with the university, I've been in contact with this. They're willing to kind of help us. I don't have any money yet to go license this and pull in the attorneys, but they're willing to, they're kind of helping us in this interim period by showing some amount of support. It's kind of a letter of support basically more than anything. That's one thing. And the other thing too is, just talk to people. Everybody has different experiences and all. I know Andrew, I think, is relatively generous with his time, but again, he's an attorney. His job is to be an attorney and, have billable hours and all. I know some attorneys, I know some attorneys are willing to do some things for equity. Others willing to defer, payments and stuff down the road. It's risky on them, but, again, there's a lot of people that are willing to take a bit of risk and kind of help out either because they've been there before or they're post-economic and they like giving back. So, all right.
Can I have one more comment, if I may, Larry?
Sure.
Part of the reason you should just have a really good relationship is not only can you just come to sort of agreements, like it's not an official option, but it's essentially an agreement. Stay in communication because, to your point earlier on the Takeda deal, hey, Venture wanted to invest in this. You might think that you have a great option from Venture, even though I love startups, even though that's a lot of what we're focused on here. If Takeda offers you a bunch of money, you should strongly consider it because you still get a lot of that economics. And so there's always the question of you should do a startup when it's an avenue to do things you can't do otherwise, right? And so if they're giving you a lot of pushback, there might be some reasons of things that you don't know about. And so that's part of why you should have that communication, because if they can go do that for you, that makes your life so much easier. So.
And I dramatically second that. I love startups and I hate them at the same time because there's that much more disproportionate. Not that I'm allergic to work, but there's a lot of issues and headaches with them. And so given a big transaction with an established company where you don't take any dilution, or door number two, which Andersen may start off owning 40, 50, 60, 70% of the company and then get diluted down to 4% or less than that. That's typically more, and sometimes the founders, a lot of times more the norm in our world. If we were talking about a Web 2.0, 3.0 type thing, where the founders could still conceivably own 40, 50, 60% of the company, I give you a different answer, but, it's just kind of the world that we live in. Yes, sir.
Yes, I have two questions. The first one is along the line of this lawyer attorney. So I guess two kind of situations. The first one is like if I have a startup and a relation with MD Anderson, and the attorney will represent me to discuss with you, right? But on the other hand, if we only talking about the patent or the proprietary properties at MD Anderson, do we really need a lawyer? Inside of MD Anderson?
So,
but like if I have things, talk to first get patent from patent office, and talk to you about this.
Normally on things, the vast majority of things that come into our shop that are ultimately commercialized or licensed, it is the scientist, the clinician, they send in what we call an invention disclosure report or an IDR, and it just says basically, I've got this cool idea for a medical device or a therapeutic or whatever, and here's the data and why this is cool. That goes to Andrew Dennis's shop. It's kind of scrubbed down from, does it need a patent, and if so, is it patentable and all that, and ultimately, hopefully, that is licensed out to industry. So it's just all internal to Andersen, and if it is ever licensed or commercialized or part of some of these things I've been talking about, there are Andersen in-house attorneys dealing with that. Dollars flow in the door, you license this for $100, you license it for $1 million, $100 million, whatever. Dollars flow in the door, there's an Andersen, in most places like this, the policies vary, but in general, dollars flow in the door, patent expenses that the university has invested in those are recovered, and then the balance is split per some formula. So Baylor's is different than ours, but everybody kind of has some sort of sharing formula that sort of follows along those lines. So that's the norm. Now, you come in and you're an Andersen scientist, but you also really would like to start a company. Honestly, the first thing, not knowing anything about it, I'm going to probably try to talk you out of that, just because, for some of the reasons we've been saying. Which is, take it for what it's worth. There are frequently folks that want to do that, don't want to leave their academic position, right. Which is, again, fine. And there are ways of being part of a startup without you leaving academia to go do that. And it just kind of depends. I mean, we're having a conversation literally just this morning with a potential CEO candidate in Brazil with 3 influential folks on campus. None of them want to leave what they're doing. I mean, they're at MD Anderson for a reason. And, you know, we're talking about how are all the pieces of the people, the technology, and the money ultimately going to kind of come together. And it depends a bit, and again, every university is different, but it's not at all uncommon in this example where like these 3 folks are probably going to sit on a scientific advisory board. They're probably going to have input into the direction of the company. They won't, just because of Anderson policies, they won't own stock directly, but when Anderson turns the equity that's part of the transaction into cash, then cash is distributed per the patent policy. When I was at Baylor for 12 years, we would get a share certificate for 1 million shares, and we would immediately turn it back around and give it to the company and say, look, we need this recut. These number of shares to Baylor, these number of shares to inventor A, B, C, you know, whatever the patent policy, kind of the percentages worked out to be, and then it was those people's individual, you know, Baylor's view was we don't want to be making investment decisions for people. I don't know what Anderson's, the rationale for it is, but Anderson distributes cash. It does not distribute stock or anything else that we've gotten in a license for consideration. So hopefully that answers your question, but it's...
So in this situation, you want the PI to talk to you directly, you actually want to have the PI to hire a lawyer to talk to you?
The PI directly. I mean, if it's an Anderson PI, no, just talk to us. I mean, we all ultimately have the same goal of getting this thing out there. Now, if you want it out there into a company that you or your brother or your friend or whatever, I mean, it's going to get more complicated, and there's some conflicts of interest and things we'll have to negotiate or navigate. But it's something critical. It's just some additional steps. But no, just talk to us. I mean, I'm sure I can speak for Michael Dillon and others in kind of the same boat at the local institutions. Talk to them. I mean, it's easy enough to start the conversation and, you know, just be transparent about what you'd like to see happen.
Yes, so over the years, I think the thing I feel is that, you know, it's for us to find, it's very hard to find investors, right? So you have given a lot of examples here that different modalities, different therapeutics, and do you have any statistics showing that, you know, how many of them actually is because of the relation of the PI with the investor? Some of them is because you guys have selling to some people, or some of them is actually some people coming in to say, okay, we know this technology, we want to do it.
It's a mix, and I mean, it's just gut feel. I don't have like data, you know, to back this up, but just what I've seen. I'd say it's skewed toward either connections that our office has with just the private equity VC community, or somebody in that VC firm saw Dr. Smith give a talk and he or she started, you know, made the connections and everything. It's happened a few times where it was an investor that the scientist kind of brought in, but I'd say it's rarer, you know. So, okay, I think there was maybe one other question. Okay.
Yeah, great talk. I have a question. You know, as investigator, we move from places to places. So if we had a licensing agreement with from another institution, with, you know, a company, but now we move to MD Anderson, both continue to work on this technology. Obviously, you know, how is there something that, you know, can leverage your expertise to continue to develop the product? Otherwise, you know.
Yeah, we've done that a few times where, you know, a person comes from University A, has years worth of work, maybe some IP that's there, they come to Anderson and they're continuing, that's the whole reason they were hired, and they're continuing on with that. There have been some times where we approached University A to try to pull that whole platform in, if it made sense. Sometimes they're receptive to that, sometimes not. And then if that takes place now, we're out talking to Merck, you know, 3 years later. This is the coolest thing since sliced bread. We've got the existing IP, we've got the newly created IP, and it's all in kind of one package. There's been some times where it just doesn't make sense, and we'll have to put some sort of interinstitutional agreement or like a prenuptial agreement, something in place where ideally either those rights flow through us, or we know that the transaction between University A and Merck and Anderson and Merck kind of sync up. But now we start getting into kind of too many cooks in the kitchen problem, and to be avoided if you can, but sometimes you just can't do it. But that happens pretty frequently. Same thing with a person at Anderson and a person at Baylor or some other place that are interacting, collaborating on something. We've got some jointly owned piece of IP. All right, we need to find a way to kind of, work together on that. Okay, let me, any more questions? Okay, I'll kind of dive back into a few more of these. And again, I appreciate the questions. I'd rather talk about this stuff real time. Okay, so I think I beat the business people doing the business discussions. What I mean by this about keeping attorneys on a short leash is, and Sarah and I were just kind of joking about this, I think a little bit earlier, I forgot who it was, I think it was you, about, you at some point you're in an agreement, you're negotiating the language, and there are 30 open items. And some, but not all, attorneys will, how are we doing on time, by the way?
We got 9 minutes, 8 minutes.
Okay, I'll really jump. Some attorneys will fight tooth and nail for every single one of those 30 items as if their life depended on it. And others were like, 27 of these really aren't that important. These 3 are really kind of what matters. And by keeping them on a short leash, that's literally kind of what I mean is that don't just I would suggest, I'm gonna take what it is, turning the document over to them kind of blindly. I would read everything, understand everything, question, make notes, talk to them about it. Because there's a lot of things like, okay, this is ridiculous. Why are we fighting over something that just doesn't make sense or that's not important to me? Kind of related to that is, certainly being cautious of letting them run up the bill. Again, kind of see the previous slide. Some of these are kind of obvious. Don't be a jerk. I'm amazed that, what is the thing, most of the important life lessons I learned in the first grade in the sandbox or whatever. This is just human nature. I mean, people don't like doing business with people that they consider a jerk, that are rude, that are arrogant, insulting. We bump into this weekly, and sometimes internally. But there's just like 5 minutes into a call, it's like, man, I don't like this person. I don't trust this guy. I'm getting the kind of the heebie-jeebies off of it. Even though everything he or she is saying is perfect, it's just these kind of things really, they're more important than I had appreciated earlier in my career. Another thing, and again, some of these are so obvious, but I have sat in numerous meetings where outside potential interested party asked some questions of our PI. Legitimate, makes sense. And it's not just scientific excitement and rigor, but it's like they're actually angry of like, are you questioning my science kind of thing? And there's been times, especially depending on the personality and phenotype of the person I'm dealing with, I may remind them of this ahead of time. But a lot of times the folks you're dealing with, they're not experts in what you're an expert in. They may not know the level of details and have the depth of your expertise. So I always look at it as questions are a good thing. If there's no questions, there's probably a problem. And they're asking questions to, one thing, get comfortable with it, vet everything, but they also have to sell this idea. I'm thinking you're a small company and you're talking to a BD person at Merck who has to then go sell this to a senior VP somewhere. They're trying to acquire information to ultimately, sell that up through their organization. So again, it seems kind of common sense, but if it didn't happen enough, there wouldn't be a slide here on it. Kind of back to the comment about sort of cleaning things up. And there's some famous quote on this, and of course I can't, so I should probably attribute it to myself. But along the lines of, there's like a million ways to say no, and very few ways to say yes. And it's one of those things. Kind of back with the previous, clean up on aisle 3 slide. We try to do anything and everything to make it very easy for the other party to say yes, whether it's showing that we're reasonable, whether it's having a data room that's well populated, that has all the questions. We'll even put FAQs in there, or questions that we kind of wish they would ask to kind of help lead them where we want them to go. We'll have table of contents, just try to make everything as easy as possible. Because these folks, the diligence team that came in with Takeda, there may have been 60 people that came into Anderson over months. And everybody has their specialty. This person is a regulatory expert. This person is a CMC manufacturing. This person has to do with, clinical trial design and statistics. And they will literally come through, these are just top of mind and in no particular order, but everything from, is the technology sound? Is the biology sound? what's the size of the market? Do they have freedom to operate? What does their IP portfolio look like? And you'll have possibly, you know, half a dozen to dozens of people come in and scrub down everything to the nth degree, looking for problems. And either problems that will kill the deal, or problems that they'll use against you. It's kind of, oh, they'll point out a wart on something and we're not gonna pay you X, we're gonna pay you something, you know, significantly less than X. And again, I've seen this enough, and I think part of it, there's a reason, this is gonna sound tacky, but I think there's a reason a lot of folks that are working at a large pharma company are working at a large pharma company versus a small startup. And it could be a comfort level, it could be a risk, you know, risk profile or whatever, but I think they're just kind of wired together differently. And, you know, I think the take home on all of this is know, from their perspective, know is safe, know is easy to come to. Oh, I didn't like this, or this, they seem like they were missing this data, or this mouse tox data seems a little, you know, a little off to me. It's not ideally what we'd like to see. And so no is the easy default term. Nobody's gonna risk their career or their reputation on something that they can't give like complete green lights and thumbs up to. And so we always, you know, kind of related to this, we always try to, I mean, never lines, I guess kind of obvious, but especially on if there's potentially bad data or missing data or something that's questionable, hit it head on. We've got a program right now, you know, of all things, the Alzheimer, don't ask me why we're working on that at Anderson, but an Alzheimer's program where, well, we've had several parties come in and really kick the tires, and there's some toxicity data which they're just a little like questioning on. It's nothing horrible, but it's not what ideally they'd like to see. And well, you know, first time everybody's like, oh, these guys are idiots, and then after you hear 2 or 3 times, like, okay, maybe we really need to address the toxicity issue because it keeps coming up, you know, time and time again. So to me, it is always better on things like this. If there is a weakness, telling them about it before they find it in a data room, or they've spent months and thousands of dollars on attorney's fees and all this only, and they're all excited about this only to kind of find some glaring issue late in the game. You've lost credibility, the deal's probably blown up, and it's just kind of a bad MO going forward. It makes sense. I mean, you know, again, back to the dating analogy, you don't lead with all your picadillos and hang-ups on, you know, the first date, but eventually they kind of, you know, they need to come out. Another thing we see frequently, and I understand, yet scientists' comfort zone is science and data. I totally get that. And it's gonna lead the conversations frequently, but it can't be the only thing, because we always look at things, I assume, if you're coming to talk to us, I assume that technology works. Now what? Now who's gonna care? What's the market? Who's gonna be the ultimate commercializing party or the licensee? And, you know, again, that assumes that the data are the data, and that, you know, what you're showing is correct, but it can't be, that's not the whole, you know, the whole story. Another just last couple of quick slides. You know, sometimes, kind of getting back to that Lego picture, I guess, a while ago, you know, sometimes a lot of times we'll have folks come to Anderson that don't know kind of what's possible, and so sometimes you have to help, well, gee, we'd like to do this, we can do it with these agreements and these steps over this period of time, and sometimes you just have to literally kind of show people, you know, how the pieces come together. Another interesting sort of, and this an example of this came up recently. You know, everybody has constraints. I have to sell stuff up to Ferran. Ferran has to sell stuff up ultimately to Peter Pisters. You know, kind of depending on what the situation is. We were dealing with this past summer with a company, and not beating each other up too much, but it finally kind of came out that their board members, it was a smallish company, their board members had undue influence on, to make granted it's the board, they should, but undue influence on the term sheets and stuff that we were talking about. So we would talk to the BD people and everybody's in agreement, and then it would come back 2 weeks later, it's like, we gotta change all this stuff, and it's like, why? And then once we kind of figured out what was going on, now we're able to almost strategize a little bit. Okay, if you give us this, we'll give you that, and that'll address your board member's concern, that addresses our piece over here. So sometimes just kind of talking through what the issues are, and what their constraints, and, you know, we're in that case, you're really on the same team, ultimately looking for the same outcome. I'm gonna skip over this, kind of thinking creative, kind of makes sense. The other thing is, frequently, and I kind of mentioned this in a couple of examples, frequently, not always, but there are ways to, what I would consider kind of carving up the pie. Working with a company that has they have a technology that allows you to address certain autoimmune diseases. Let's just leave it at that. They can't boil the ocean. They can't go work on all autoimmune diseases at once. So why not carve out a portion of that or other applications of this technology, give it to somebody else. You can focus over here. You've hopefully got some money or some economics that come in because of that, and you really haven't lost anything. It's not like you've given away the crown jewels. You've given it away for this very specific thing. And again, this is not always applicable, but sometimes there are ways to to kind of split things up, and it's not hurting. If anything, it's helping you because you're broadening or you're de-risking it a bit. Last couple of quick slides. I kind of joke about this, but a collaboration literally, in fact, should be collaborative. I'm amazed at the number of discussions that we have with companies coming in and early on, and you realize that they're not looking at Dr. Smith or Dr. Jones because he or she is an expert in this. They're looking at them as a set of hands or a hired technician or whatever. And we'll frequent, there's many conversations we've shut down with folks of like, look, if you want a CRO, go talk to Lonza. I mean, there are other places to go out there and hire this expertise, but if this isn't a collaborative, intellectually stimulating effort for the clinicians and the scientists here, this isn't gonna work. They're not your hired hands. And we need to appreciate that they've got academic pressures which are different than your pressures as a company, and let's kind of talk about that and I'll be aware of it, but it needs to be a two-way street and kind of a collaborative effort. Again, it's to me sort of obvious, but it's not always in reality. And there's been many of these that I wish the personalities were different, but we just had to back away just because you can already tell it wasn't a healthy relationship. All right, last slide. Again, bias toward therapies and that kind of thing. Years ago, I met with a guy, small company, I think they were working on melanoma, I can't remember. And early on in the discussions, they're pushing into the clinic with a melanoma therapy, and in the discussions realized that they had never talked to a melanoma clinician. I didn't even know what to how to say. One of the beautiful things about a place like Anderson is not only are the clinicians, they're the ones seeing the patients and they know, but they also know, standard of care, but they also know what else is in the clinical research pipeline of what your idea is going to be competing with. So it's not just the existing approved product on the market, it's also what's in the clinic and what's kind of making clinical research, like phase 1, phase 2 trials. And having them buy into the idea and influence clinical trial strategy and that kind of thing, and patient populations and ways to frame this, and how is this going to address previous attempts at this target or whatever the case is unbelievably valuable. And I'm amazed at how at times infrequently their expertise is not brought in until way too late, and then they don't care. So I guess the last point, following up with people, there's a fine line between following up and stalking. I get both accused of this as well as having people kind of stalking you. Well, everybody's busy, that's one of those things that at times you just have to realize that, this may be the most important thing to you or to me, and it's one of 79 things that the person you're working with at Merck or Novartis or whatever is working on. So, there's, I guess patience is always needed. Okay, that's generally all I had. Hopefully, at least this stimulates some thoughts and discussions as you guys go forward with these programs and all. And Sarah knows how to get a hold of me. You can go to the Anderson website, and my email, contact information, everything is on there. And so with that, I'll be quiet.
That's time, so. All right, everybody. I don't know, Larry, if you can